Welcome to step 4 of our journey to brain health. Alleviating stress. Have you ever felt like you're burning the candle at both ends, with no time to breathe? Or what we often describe as being stressed out? While most of us would prefer to avoid it altogether, we know that a certain degree of stress is inevitable, and in some cases, may even be helpful. So, how can we adapt to stress in a way that heals rather than harms us? The first thing to realize is that not all stress is bad. We are constantly exposed to all types of stressors, which can be physical, psychological, or environmental. While there is no clear upside to environmental stressors, such as noise or air pollution, others, like acute stress from exercise, can make us physically and mentally stronger. Each of us experiences different stressors and responds to them differently. Psychologists define stress as the process by which we perceive and respond to stressors that we view as challenging or threatening, which means your response to stress can be healthy or harmful, depending on how you process it. Acute stressors, like a deadline, can make us more productive by motivating us to reach our goal, especially when viewed as an achievable challenge. Chronic stress, on the other hand, where we constantly feel overwhelmed or threatened, can be harmful to our health. Chronic stress ages us. Chronological age represents the number of years we've been alive, while biological age reflects our body's health and functional status, such that it does not necessarily match our chronological age. Stress can accelerate biological aging, causing individuals to age approximately 1 to 2 additional months each year. Why does stress make us age faster? When we are stressed, our bodies release a hormone called cortisol. This hormone can increase blood pressure, leading to hypertension, which damages blood vessels and reduces the blood supply to the brain. Cortisol also induces structural changes to the brain through the loss of neuronal connections, leading to fewer brain cells in the regions involved in memory and learning. Moreover, stress weakens the immune system. Have you ever gotten sick after a stressful event like an exam or project deadline? That's what happens when stress dampens immune cells, lowering our resistance to infections and contributing to low-grade inflammation. How do we avoid the negative consequences of stress? One way is to avoid chronic stressors by planning ahead, organizing our tasks, or setting realistic goals. But for things we cannot control, we can cultivate a healthy attitude towards stress by viewing stressors as a challenge and an opportunity for growth. One trick is to use positive affirmations, such as, "I am capable of overcoming this challenge." Practicing mindfulness can also help us stay present in the moment and cultivate awareness of our thoughts and emotions, without judgment. Understanding why we are feeling certain emotions and how they relate to past experiences can help us figure out steps to interrupt or resolve any negative feelings. For example, if an upcoming presentation causes anxiety, reflect on why you feel this way, such as memories of past critical feedback. Then, use it to take actionable steps such as sharing your presentation with a trusted colleague beforehand to get constructive feedback and reframe negative thoughts from, "What if I fail?" to, "I have prepared well, and I can handle this challenge." Practicing gratitude, spending time in nature, meditating, practicing yoga, and socializing with friends can also reduce negative stress. Over time, these activities can build resilience in the brain circuits against anxiety and depression. These stress-mitigating activities can also reduce risks of conditions like cardiovascular disease and insomnia. So, let's see stress as growth opportunities and cope with it actively. Stay tuned for more steps to brain health. For more information and to read up on the evidence, visit cognitivevitality.org.